You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I am excited to be joined today by Dr. Dina Hassouneh. Dr. Hassouneh is a professor at Oregon Health and Science School of Nursing. Her work focuses on inequities in access to and quality of healthcare and health professions education. Dr. Hassouneh highlights the importance of doing research with marginalized and vulnerable populations. Her dissertation focused on domestic violence in the American Muslim community, and discussing the subject at the time was considered taboo. Dr. Hassouneh was one of the first researchers to break the silence on the topic and laid the groundwork for women in American Muslim communities to form committees to address domestic violence in their own communities. Dr. Hassouneh is a fellow of the American Academy of Nursing. Welcome to the show, Dr. Hassouneh.
Oh, thank you. Thank you for having me. It's my pleasure to be here.
Thank you. So we'll start with my regular question. How did you get started in the world of nursing?
Well, I actually, it was because I overheard a conversation while I was taking prerequisites. I wanted to be a social worker originally. And I was taking one of the prerequisites. It was an economics class, and I overheard two social workers talking during the break about their pay. And I was like, oh, I don't think I want to be a social worker. How can I try to do, similar work, but have a more reasonable, more living wage? And so that's kind of where that transition occurred. But originally I did want to go into social work.
Oh, fantastic. So it's interesting that so many of the individuals I speak to, not everybody, but a lot of people who have actually, have gone on and are doing like great work in the world of nursing, and sort of the influencers of nursing did not intend to go into nursing, including myself. I was going to be a PA, and then I realized that it went into a master's program at the time, and I was like, there's no way I'm getting my master's. So I'm like, what else can I do that's still around in the same realm? So your influence, any kind of like family influence on that, or was it purely the fact that I may not be able to make a living being a social worker?
You mean why I decided not to be a social worker? Yeah. No, that was the I felt that I needed to be able to support myself financially, and so that was the main reason why I did switch.
Yeah. So you how was your experience in nursing school, since it wasn't really on your it was sort of like you were able to do some of the work that, social work is, I think, is kind of incorporated into nursing, but how was your experience going into nursing? Because I think it's a different mindset being a social worker versus going into nursing, where you're dealing with way more with body parts and body fluids and all kinds of stuff.
Well, so I think my experience has been different depending on the various programs that I graduated from. But if you were talking about my undergraduate program,
yeah,
I graduated from the University of Washington. And the University of Washington, it might still be, but at that time it was the #1 school in the country for nursing, which we heard about a lot as students. And I felt that was not helpful. you're right. It's a different type of focus, a different type of cultural environment in nursing, I would say, compared to other areas. And I had a difficult time with that, actually. I ended up doing a dual degree and getting a degree in women's studies, which I thoroughly enjoyed, and really helped me keep going.
Well, now it's interesting that you mentioned that because there are, including myself, even though I had a healthcare background before I went into nursing, I had a difficulty transitioning into the culture of nursing because it has its own, unique attributes that I was coming from a military background, which is a primarily all large male population, working with men pretty much my entire career, to an all female occupation or profession, I should say, which is very very interesting that you mentioned that because yeah, I also had that experience. Now you mentioned your women's health. Was it women's health
Women's
studies?
studies.
So women's studies. Now, how much of that influenced you in moving to a higher level of degree and doing some of the work that you're doing now?
I don't know that it influenced my decision to pursue graduate education, but I think it did inform the work that I've done over the course of my career. I found that, at least when I was an undergraduate anyway, that the exposure to theoretical perspectives and scholarly literature in nursing was extremely limited in terms of its scope and depth relative to the human sciences and how systems of oppression shape people's lives, and in particular women's lives. So I I learned a lot in that women's studies program, and it kind of started me on a path of becoming really interested in learning more about theory and research that draws on those more critical perspectives.
Wow. Now, as you mentioned, so for your graduate, so if this was not it helped with the kind of work that you did down the line. What made you decide to actually pursue graduate education? Because it's not on everybody's like to-do list. It was definitely not on my to-do list. Life happened, and I decided that I was going to move on to graduate school. So, what was the decision for you to pursue a graduate degree?
Well, I actually had a plan to get a PhD before I ever entered my BSN program.
Wow.
And there were a few different reasons for that. One of them that I felt that I had strengths that would work well in an academic environment. I always enjoyed school. I always enjoyed learning, and I believe that research would allow me to explore new and different topics where I would be able to continue learning. There were other reasons as well, which were more personal reasons, and some of it had to do with, just proving that I could be somebody, I think.
Uh, were any of those influences like through family or mentors, anything like
Yes,
that?
family, yes.
So you moved into your graduate program. What did you end up studying once you went into your graduate program?
Well, I actually studied a few different things. So when I finished my BSN, at that time, you had to have a minimum of 1 year of clinical experience before you could enter a graduate program, which obviously that's no longer the case. But at that time, it was a requirement. So I applied and to a master's of science in nursing focused on community health, and I was admitted after a 1 year of clinical practice, and I finished that program. But I decided that I wanted to expand my skills, and so I ended up doing a postmaster's to gain certification as an adult nurse practitioner. And it was after finishing that I went into my PhD program. And I actually became interested in psychiatric nursing, which is kind of, I guess, harkens back to my earlier interest in social work, and enrolled in another postmaster's program after several years after completing my PhD, and gained certification as a psychiatric mental health nurse practitioner.
Wow. You're a degree collector.
I guess you could say that.
That's
Yeah.
fantastic. But it's interesting. Actually, I had, for myself, like I was doing some work that led itself towards public health, and I started thinking about, should I get a master's in public health? And my wife was kind enough to talk me out of that. So like, see if there's any kind of work you could do instead of getting another degree. But yeah, I'm sort of the same way. I find an interest, and all of a sudden my brain goes towards, should I get a degree in this? So that's fantastic. Um, Now, I want to talk a little bit about your PhD work. What made you decide? Because this is sort of not necessarily the topic, but how people choose the work that they do in their PhD programs. When I went into my PhD program, I wasn't thinking. I did my work around veterans topics, but I didn't go into my PhD program thinking I'm going to be doing that. Some of the experiences in my first couple of months of being in the PhD program, kind of made take a like a left hand turn into the topic I ended up pretty much building my portfolio around. What made you decide this was the topic? Because it's not one of those topics that people just say, "I want to do this."
Mhm.
How did you decide that this is going to be the topic you're going to study?
Yeah. Well, I actually most of my teaching over the course of my career has been in a PhD program. So I don't think your experience of, not having a necessarily completely nailed down topic when you enter is that unusual. I think that's fairly common, actually. But for me, I actually was interested in this topic when I was a master's student. At that time, because it was a master of science, we needed to write a thesis.
Mm.
And so I did that, and it was focused on the topic of domestic violence in the American Muslim community. I was very fortunate to have a faculty member when I was a master's student who said, you should turn this into an F-31 application, which is, for those people who don't know, an individual fellowship that helps you pay for your PhD education, this one was funded by the National Institute of Nursing Research. And so I wrote that application as a master's student. At the time that I was in the master's program, I didn't realize that our PhD program, we had two T32s at that time, which were our institutional grants that pay similar benefits for people who were in doctoral programs, but I didn't know about them. Nobody told me about them. So I believed that if I didn't get this individual fellowship, that I wouldn't be able to get a PhD because I had already borrowed so much money, all these other degrees, that I didn't think that I could borrow any more money and actually be able to pay it all back. So I was very fortunate that I actually did get awarded that fellowship, and the news came through in September of the year that I was supposed to enter the program.
Wow, that's amazing. Well, congratulations on that. I was fortunate enough to get a HRSA grant that paid a nice chunk of it off. So I still have a little bit left, unfortunately, but
Hmm.
this much less than what I borrowed. So I'm grateful. Yeah, it's always great. Yeah, you mentioned the cost of higher education, and it just triggered something for me right now. Um, how do you think you are in higher education? How do you think the cost of higher education influences the talent that comes into nursing, or how much of a barrier, I should say, it is? when people don't know about the availability of different programs to pay off. In your opinion, what has been your well,
Yeah, I
we know
think
about
it,
your personal experience, but how do you think, how much of it do you think it plays a role?
I think it's highly significant because some people, they may not feel comfortable borrowing that much money. Some people may have family commitments if they come from socioeconomically disadvantaged backgrounds. They may have family commitments or they need to help support family, and the cost can seem very daunting. And then, also based on my experience working as a faculty member in a PhD program for more than 20 years, it's very common to expect students to work only part-time, if at all. People who work they don't kick you out for doing it, but I think it's frowned upon in general. It's sometimes, I think, seen as reflecting a lack of commitment on the part of the student. And I think that that's a really problematic, because then what you might end up with is you might end up attracting people from more middle class and upper middle class backgrounds, which is really, already most of probably what we already have. So at the same time, that nurses practice with a very diverse population, including many people who do not come from middle class and upper middle class backgrounds. And so I think having people who come from those backgrounds is invaluable in being able to connect and understand with patients who are having or have had similar experiences.
Yeah, I 100% agree with that, and that was sort of what I was hoping you were going to allude to, is the fact that we are missing the diversity in researchers, um, uh, because that personal experience and that personal knowledge that they bring to the game is on a whole different level, right? It's actually one of the reasons I have an issue with the word cultural competency, because I always tell people there's no way I'm going to be culturally competent in somebody else's lived experience, right?
Mm-hmm.
So I think it's in part um, I want to share or ask you, what do you think nursing can do in order to increase that pool of diverse individuals in research? What else can we do? Because money is definitely a barrier. When the Future of Nursing report came out in 2010, and they said let's double the number of doctoral prepared PhDs and DMPs, the PhDs stayed rather flat, while the
Mm-hmm.
DMPs significantly grew.
Mm-hmm.
But I don't think we really achieved, from a researcher perspective, I don't think we achieved what we needed to, because again, the money is a huge issue getting people into graduate programs and PhD programs. So, what do you think nursing can do better than what we've done in the past?
Well, one of the things that I've seen happen that didn't really, wasn't, at least wasn't aware of it at the time that I was a doctoral student, was that it's number of schools will have what they call scholarships and stipends based on the NIH schedule. Now, it might be that there's a proliferation of PhD programs, so there's probably a limited number that actually have this financial support. But there are some schools that have that. It's usually, based on my experience, not sufficient, and there aren't usually enough slots. So I think it's better than nothing, but it's really woefully inadequate. One of the things that I think that we could consider doing is prioritizing health equity and health justice for people who do apply for those slots, where the financial support is available. And I also, I mean, I really, to be honest with you, I'm a real critic. So I think that we need a real restructuring of what our priorities are. And that means a real investment in a financial investment in changing how the culture of our programs, the qualifications and knowledge of our faculty members, because of course that's very significant for the student experience, and as well as forging connections with communities to help create bridges for people to enter. So I think we're really in my experience, there has often been an attitude, well, and actually this is a direct quote. I once heard somebody say this, well, a PhD is a privilege, not a right, which is, that is actually true. But at the same time, it does seem to be more of a right for some people rather than other people. So that's something that we really we need to, if we really want a diverse array of scholars, we need to support them, and we need to put our money where our mouth is, as well as policies. I think that we need policies with teeth. We have policies for diversity, equity, inclusion, but what I've seen is very often it's lip service, and you can have people who are subjected to the most stressful types of discrimination without any ability to find relief.
Yeah, I completely agree. And I think one of the reasons that this season of the podcast I really want to talk about the EDI components is everybody in nursing has rightfully jumped on the bandwagon that this is the work that we need to focus on, and that's to be commended. But where are the policies that are really making change? And as you mentioned, policies with teeth, right? Where are those other than, I'm now, having said that, your work around inequities in access and quality of healthcare, how has that, well, first of all, if you can share with us, how has that integrated into the work, into your daily life as somebody in academia and as a researcher?
My daily work life, you mean?
Yeah.
Yes. Okay. So I would say that is a perspective that is part of who I am. And so it's always present, and it influences how I perceive other people's work as well as my own. It influences the students that I choose to work with and who choose to work with me. It influences, I think it's influenced my journey, because I think depending on whatever the environment you're in, it may make your journey more challenging. And I personally believe that has been the case for me, because it's, it sometimes is you're kind of going against the grain when you are someone who brings a perspective that is can make people uncomfortable and really kind of is saying we need change here, that when people are used to doing things a certain way.
Yeah, and I appreciate that perspective. I really do. Now, has there, and this is as you're sharing this with me, has there ever been a moment in your career where your perspective has not been received well by the nursing community? Because I know in nursing, like I said, it has its own history, good and bad, and I know people, as you mentioned, who are sometimes against the grain or swimming upstream, are sometimes met with these challenges, right? That are because of the history of nursing and who sits at the table at nursing. So have you ever had you don't have to name any names, but have you ever ran into those issues in your career, and how did you manage to go around or go through those obstacles?
Well, I think that it's constant. It's constant. And so one of the things that I've noticed and that I've experienced is that there are many students who are from marginalized backgrounds that are interested in health equity and justice topics, and tend to have a disproportionate number of them that I work with in the program. And so I very often will end up bringing up issues relevant to the student group, and I probably would anyway. So, but it's not, there's a lot of resistance. And unfortunately, what I see in a PhD program context is a lot of emphasis on NIH funding, a lot of emphasis on R01s specifically, the big grants, and not so much emphasis on this issue of equity and justice. Equity and justice, yes, if you can get an R01. But otherwise, look at the funding priorities, which up until to a couple of years ago, maybe weren't necessarily focused on health equity at all. And so I think that sends a message. I've also unfortunately had students who experience discrimination. I've had to try and advocate and work with those students, and it's been actually quite difficult emotionally.
Yeah. Yeah, I agree with everything you're saying, but I've actually, having been in academia now for going on 6 years now, I've definitely noticed the tiering of schools and how they hire, and the hiring process really is around, unfortunately, the people with those large NIH grants, or people who can afford to be in a postdoc, I should say, tend to get the schools with the most resources, right? So I think that's definitely something that is also prohibitive of us getting more diversity in faculty and mentors in those institutions. I think that's a big issue. That I think nursing needs to address at some point and say, if this work is really important, then we need to fund this work and hire the people that are going to be in those roles. Because, for example, myself being a prime example of, I didn't have, not that I couldn't go to a postdoc, is that I was the primary breadwinner of the house. I can't afford to go to a postdoc where my pay is going to be so much lower that I can't even pay my mortgage, right? So can't pick up the wife and kids and just move to another state. So there's all these barriers that really the programs are set up for a very specific group of individuals, and I don't think we're providing enough opportunities as a profession for that diversity to kind of take place. So very true, very true. Anything you want to share? I know we've talked about your work that focuses on health equity and justice. What can nursing do better in this arena overall that you don't think we've had the opportunity to really address as a profession?
Well, we need accountability in our leadership, and I think that's really fairly absent, is from what I can see. There's a lot of emphasis on budget, and in my opinion, not enough emphasis on what we've been talking about, health equity and justice. You can go out and talk about health equity, but what are you doing to actually promote health equity and, as you say, a more diverse faculty and more diverse graduates? So some of those things are measurable. And I think that, just as an example, at my own institution, which frankly, I disagree with this, but executives get large bonuses for coming in under budget. And I think just part of their role, it's very, it's problematic in my opinion, but it exists. So, why not, if you're going to have that kind of system, why not, tie those to these measures of equity instead of only focusing on the budget? I suspect that if people had, thousands and thousands, and depending on your job at the university, sometimes millions of dollars coming in for a annual bonus, that you might be highly motivated to actually show more significant progress than without any actual, no ascertainable concrete outcome that will have an effect on the leadership for not making progress that we need to make.
Yeah, I agree. And I think it's the same. It's not just academia. The service side is the same exactly. Having been in the administrative side of service, the budget, sometimes you have to question what's running the show, patient outcomes or the budget.
Mm-hmm.
Those bonuses are definitely the things that they tie them to aren't necessarily what is best for what you're looking for your outcomes to be. So I agree. I agree with that wholeheartedly. We're almost out of time. Anything else you want to share about your work, or anything you would like to leave us with?
Well, I think that I would just hope that people who are listening, recognize that though, there are challenges and there are difficulties, we definitely need nurses who are have critical perspectives, who recognize the importance of justice and health, and are willing to kind of carry that torch, into the future. It's extremely important, and I hope that there are people who have those interests, who have those values, frankly, that are willing to think about having an impact. Because after having done it myself, at least attempted to anyway. I mean, not really. I'm not sure if how much I achieved, but I've certainly put in effort. I'm getting kind of worn out. So we need some new people to come in and continue that work.
I appreciate that. You triggered one more question in my head, and I'm going to ask this: if I was listening to this podcast as a new nurse, or someone who hasn't been involved with the work of health equity or justice, what would you recommend a first step for me be?
Learn about systems of oppression, learn about health equity, open your eyes. It can be painful because it's not pretty, right? But you have to know, you have to understand that there's a nuance, there's complexity, and there's overwhelming evidence everywhere of the problem. And so learning about this and recognizing and being willing to grapple with it is the first step.
Great. Thank you. Well, thank you so much. I appreciate your time. We have been listening to Dr. Dina Hassouneh. She is a professor at the Oregon Health and Science School of Nursing. Thank you very much, and we'll talk again soon.
Thank you.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.